What if I told you that cholesterol, the word that so many fear, is not your enemy, but your body's quiet architect of balance, that within every heartbeat it plays both the villain and the hero, depending on how we understand it. For older adults, this isn't just about numbers on a lab report, it's about how the orchestra of life inside your arteries performs with age, harmony, or chaos. This talk is for educational purposes only. It does not replace medical advice. Always consult your healthcare provider for personalised recommendations regarding your health and treatment. Cholesterol has long been framed as an enemy of human health, a silent saboteur lurking in the bloodstream, waiting to clog arteries and endanger lives. But this narrative is dangerously incomplete. In truth, cholesterol is not the enemy. It is one of the body's most essential biological allies, a molecule of remarkable complexity and purpose. It is present in every cell membrane, woven into the very architecture of human life. Without cholesterol, there would be no cell integrity, no hormone synthesis, and no brain function as we understand it. To vilify cholesterol is to misunderstand the elegant balance of biology that sustains life. The human body depends on cholesterol in the same way it depends on oxygen or glucose. Not too much, not too little, and always in the right form. Cholesterol's first and most fundamental role is structural. Every cell in the human body, from the neurons firing in the brain to the muscle fibers contracting in the heart, is enclosed in a membrane, a delicate boundary that allows life to exist. Cholesterol sits within this membrane like a stabilizing agent, giving it the perfect blend of fluidity and strength. Too little cholesterol and the membrane becomes weak, leaking and fragile. Too much and it grows rigid, resistant to change. This microscopic balance is what allows cells to communicate, adapt and survive stress. In older adults, as cell regeneration slows, this balance becomes even more vital. Cholesterol helps maintain cellular integrity during the natural wear and tear of aging, ensuring tissues remain functional despite the body's gradual decline in repair capacity. Cholesterol also serves as the foundation for steroid hormones, chemical messengers that regulate nearly every physiological process, from metabolism and immunity to mood and sexual function. The adrenal glands, ovaries and testes all use cholesterol as a raw material to produce cortisol, estrogen, testosterone and progesterone. In later life, when hormone production naturally declines, cholesterol's role becomes even more precious. It provides the substrate for these hormones to be synthesized, sustaining vitality, emotional balance, and resilience against stress. Low cholesterol, particularly in older adults, can therefore mean more than just low risk. It can mean insufficient hormonal support, contributing to fatigue, low mood, and weakened physical endurance. Beyond its structural and hormonal roles, cholesterol is indispensable for brain health. The human brain, despite representing only about 2% of total body weight, contains roughly 1/4 of all the cholesterol in the body. It is not a coincidence. Cholesterol helps neurons form synapses, the communication junctions that allow thoughts, memories, and emotions to arise. It supports the myelin sheath, the insulating layer that allows electrical impulses to travel rapidly between neurons. When cholesterol levels fall too low, the brain's signaling efficiency declines, impairing cognitive clarity and memory. Several studies have linked excessively low cholesterol to increased risk of depression, anxiety, and even neurodegenerative disorders. The aging brain, already vulnerable to slow repair and oxidative stress, depends heavily on a steady supply of cholesterol to maintain cognitive sharpness and emotional stability. Another often overlooked function of cholesterol is its role in producing vitamin D, the hormone-like nutrient that regulates calcium absorption, immune function, and bone strength. The skin synthesizes vitamin D when ultraviolet light interacts with a cholesterol derivative called 7-dehydrocholesterol. In older adults who often spend less time in the sun and whose skin becomes less efficient at this conversion, adequate cholesterol levels become even more important. Without sufficient cholesterol levels become even more important. vitamin D synthesis falters, and the risk of bone fragility, immune weakness, and metabolic disorders rises. The very molecule long blamed for cardiovascular harm turns out to be the starting point for one of the body's most protective substances. Cholesterol also plays a subtler but equally vital role in repairing damaged tissues. When inflammation or injury occurs, for example in the lining of a blood vessel, the body sends cholesterol to the site as part of its healing response. LDL particles, often labeled bad cholesterol, deliver cholesterol to these tissues so that repair can take place. This is not an act of aggression, but one of preservation. Problems arise only when the underlying inflammation persists, trapping cholesterol in the arterial walls where it becomes oxidized and hardened. The cholesterol did not cause the damage. It arrived to repair it. It is chronic inflammation, often driven by poor diet, inactivity, smoking, or metabolic disease, that transforms this healing mechanism into a source of danger. Understanding this distinction changes everything. Cholesterol is not the cause of the fire. It is the firefighter responding to the smoke. In older adults, cholesterol's role in immune defense becomes increasingly important. It forms part of the membrane of immune cells, influencing how they detect and respond to pathogens. It also binds to bacterial toxins, neutralizing them before they can cause harm. As the immune system weakens with age, the presence of adequate cholesterol helps sustain these frontline defenses. Paradoxically, lowering cholesterol too aggressively can weaken immunity, making the body more susceptible to infections and slower to recover from illness. Once again, the goal is not elimination, but balance. Maintaining enough cholesterol to support defense without tipping into excess that fosters inflammation. When we examine cholesterol through this lens, it becomes clear that its function is not purely biochemical, but deeply philosophical. It represents the human body's need for equilibrium between structure and flexibility, creation and control. It is a molecule that teaches moderation, illustrating how life itself depends on precise balance rather than extremes. Older adults, in particular, embody this lesson. Their bodies have endured decades of adaptation, injury, healing, and growth. Cholesterol is part of that lifelong dialogue, adjusting to each stage of existence, ensuring survival even as systems slow and falter. What medicine has too often missed is that cholesterol, in its natural form, is neither poison nor panacea. It is an essential mediator of life, responsive to the body's internal and external environment. The challenge is not to suppress it blindly, but to understand how it interacts with age, diet, stress, and genetic factors. When viewed correctly, cholesterol becomes a mirror of our health, reflecting inflammation, metabolism, and hormonal vitality. It tells a story not of disease, but of adaptation. It shows us how the body worked tirelessly to preserve balance, even in the face of time. As the human body ages, nothing within it remains static. Every cell, organ, and molecule participates in a quiet evolution, adjusting to the subtle decline in biological efficiency that time imposes. Cholesterol, too, follows this rhythm of change. What was once a simple metabolic constant in youth becomes a far more complex and delicate system to manage in older age. The body's ability to regulate cholesterol depends on the liver, hormones, enzymes, and even the structure of blood vessels, all of which transform as the decades pass. Understanding cholesterol in the context of aging means recognizing that it no longer behaves the way it did in midlife. The same levels that once seemed harmless or even optimal may now carry different implications because the body's internal environment has changed. In younger years, the liver performs its role as the primary regulator of cholesterol with precision and resilience. It synthesizes, packages, and recycles cholesterol through lipoproteins, tiny transport systems that shuttle fats throughout the bloodstream. LDL, HDL, and other particles move efficiently between tissues, maintaining equilibrium between production and clearance. But with age, the liver's capacity for lipid metabolism begins to slow. Enzyme activity decreases, receptor sensitivity declines, and the fine-tuned mechanisms that once balanced cholesterol become less responsive. The result is a natural tendency for LDL to rise and HDL to fall, even when diet and lifestyle remain constant. This is not a failure of discipline, but a biological inevitability, a sign that the machinery of metabolism has begun to lose some of its youthful precision. Compounding this shift is the gradual loss of hormonal regulation. Hormones such as estrogen and testosterone play key roles in cholesterol metabolism. In women, estrogen has long been known to enhance HDL levels and reduce LDL, providing a protective effect during the reproductive years. But after menopause, when estrogen levels drop sharply, this balance begins to reverse. LDL tends to climb while HDL declines, contributing to a higher risk of arterial stiffness and atherosclerosis. In men, declining testosterone levels with age can produce similar metabolic consequences, reducing muscle mass, increasing visceral fat, and altering the way the body handles fats and sugars. Thus, the endocrine system's transformation becomes an invisible but powerful driver of cholesterol change. The aging process also brings about structural changes in blood vessels themselves. In youth, arteries are supple and responsive, lined with smooth endothelial cells that regulate blood flow and resist damage. Cholesterol moves through these vessels efficiently, guided by healthy circulation and robust antioxidant defenses. But as years accumulate, oxidative stress, chronic inflammation, and glycation gradually erode this inner lining. The arteries lose their elasticity, micro-injuries accumulate faster than they can be repaired. These damaged sites become sticky, trapping cholesterol particles that would otherwise pass harmlessly. LDL, when exposed to free radicals or inflammatory cytokines, oxidizes more easily, transforming from a neutral transporter into a potential irritant that fuels further damage. Aging, therefore, changes not only how much cholesterol exists in the blood, but how that cholesterol behaves once it reaches its destination. Metabolic slowdown is another fundamental shift that alters cholesterol dynamics in older adults. With age, the body's demand for energy decreases as muscle mass declines and physical activity lessens. The metabolic rate drops and fat oxidation becomes less efficient. Insulin sensitivity often diminishes, leading to higher blood sugar and more triglyceride accumulation. These metabolic adjustments alter the balance of lipid particles in circulation. LDL particles tend to become smaller and denser, a form more prone to oxidation and arterial deposition. Meanwhile, HDL particles can lose functionality, becoming less capable of clearing cholesterol from tissues. It is not just the amount of cholesterol that changes, it is the character of the molecules themselves. The liver's ability to recycle cholesterol through bile also weakens with age. Normally, cholesterol is converted into bile acids, stored in the gallbladder, and released into the intestines to aid digestion and fat absorption. In older adults, bile production and flow can slow down due to diminished hepatic enzyme activity or the presence of gallstones. As a result, cholesterol clearance declines, allowing more of it to accumulate in the bloodstream. This slowdown contributes to the pattern of mild hypercholesteremia often seen in older populations, even among those who maintain disciplined diets. Dietary absorption also evolves with time. The small intestine's efficiency in absorbing fats and nutrients changes, and so does the microbiome that supports digestion. The bacterial populations that influence cholesterol metabolism, particularly those that convert bile acids and regulate lipid absorption, can shift significantly with age. Some species that help remove cholesterol from the body decline, while others that promote reabsorption may increase. The digestive system, once a balanced ecosystem, becomes more unpredictable, subtly affecting how much cholesterol is taken in and how much is excreted. Another crucial factor is the interplay between aging inflammation and oxidative stress. Chronic low-grade inflammation, sometimes called inflammaging, becomes a defining feature of older physiology. It arises from years of accumulated cellular damage, environmental stresses, and immune system decline. This background inflammation alters lipid metabolism by activating the liver's inflammatory pathways and impairing LDL support function. The result is slower clearance of LDL from the blood and higher levels of oxidized cholesterol particles circulating in the system. The immune cells that normally clean up these particles, such as macrophages, also become less efficient, allowing more oxidized cholesterol to accumulate in the arterial walls. Genetic expression changes with time as well. The activity of genes responsible for producing key enzymes and receptors involved in cholesterol transport, such as HMG-CoA reductase and LDL receptors, becomes less regulated. Mitochondrial function, the cell's energy source, also deteriorates, leading to less efficient fat metabolism and more oxidative byproducts. This combination creates a metabolic environment where cholesterol levels naturally drift upward, even in the absence of significant dietary fat intake. All these physiological changes highlight a deeper truth. Cholesterol levels in older adults cannot be interpreted in isolation from age itself. What appears as high cholesterol may, in part, reflect the body's adaptive response to aging tissues. Cholesterol, after all, is essential for repairing cell membranes and producing hormones that help maintain stability in the face of decline. The increase in cholesterol with age may represent a compensatory mechanism rather than a pure pathology. The body, sensing more damage and less repair capacity, may elevate cholesterol production as a means of protection. This evolving relationship between age and cholesterol calls for a more individualized understanding of what normal means. A cholesterol level considered high in a younger person may be perfectly functional in an older one whose metabolism and vascular systems have adapted differently. The idea of a universal target loses meaning when the biological context shifts so profoundly with time. The aged body's relationship with cholesterol is no longer one of strict regulation, but of delicate negotiation, a continuous dialogue between preservation and risk, repair and restraint, all shaped by the inevitable transformation that comes with age. The human bloodstream is not a simple highway of nutrients and oxygen. It is a living, dynamic ecosystem of particles constantly exchanging energy, information, and material. Among these particles, cholesterol carriers, LDL and HDL, play a particularly complex and misunderstood role. They are not opposing forces in a simplistic good versus bad battle. They are partners in a delicate biological negotiation, transporting cholesterol to where it is needed and returning it when its work is done. Health and disease emerge not from the existence of these molecules, but from how they behave, interact, and balance one another. The true danger lies not in cholesterol itself, but in imbalance, a distortion of harmony between LDL and HDL that reflects deeper disruptions in metabolism, inflammation, and lifestyle. Low-density lipoprotein, or LDL, lipoprotein, or LDL, is often cast as the villain in cardiovascular health. It carries cholesterol away from the liver and delivers it to tissues throughout the body to repair cell membranes, synthesize hormones, and support healing. This transport function is vital, and without LDL, the body would lose one of its key systems for distributing raw materials. The problem begins when LDL particles linger too long in circulation or become chemically altered by oxidative stress. In their natural form, they are harmless couriers, but when oxidized or glycated, they transform into irritants that trigger immune responses within the arterial walls. Macrophages, the body's cleanup cells, rush to engulf these altered particles, forming foam cells that accumulate into plaque. Over years, this slow process of inflammation and repair can narrow arteries, harden vessel walls, and reduce blood flow, a phenomenon we recognize as atherosclerosis. High-density lipoprotein, or HDL, performs the complementary task. It collects excess cholesterol from tissues in the walls of blood vessels, returning it to the liver for processing and excretion. This is why HDL has been labeled the good cholesterol. It acts like a cleanup crew, maintaining the fluid exchange of lipids and preventing buildup. However, recent research has shown that not all HDL is equally effective. The functionality of HDL, its ability to prevent oxidation, reduce inflammation, and facilitate reverse cholesterol transport, matters more than its concentration. In aging bodies, HDL can lose some of this protective quality. becoming less efficient and more inflammatory under the influence of oxidative stress, chronic illness, or poor diet. Thus, the balance is not purely numerical, but qualitative. It is about the behavior of particles as much as their quantity. The interplay between LDL and HDL is a continuous cycle of distribution and recovery, one that depends on harmony rather than elimination. When LDL rises slightly but HDL is active and abundant, the system remains stable because excess cholesterol is promptly returned to the liver. When HDL declines or loses function, even normal LDL levels can become hazardous. Similarly, if LDL particles become too small and dense, a pattern often seen of metabolic syndrome and insulin resistance, they penetrate the arterial lining more easily and oxidize faster, tipping the balance toward inflammation. The physical characteristics of these lipoproteins are shaped by diet, genetics, hormonal shifts, and even stress. This complexity is why treating cholesterol purely as a numerical problem fails to address its biological essence. Inflammation is the invisible hand that turns this imbalance from a benign state into a dangerous one. Inflammation modifies LDL particles, making them more likely to stick to the arterial walls and attract immune cells. It also weakens HDL, reducing its antioxidant capacity and disrupting reverse transport. In this inflammatory environment, cholesterol becomes collateral damage, caught in a process meant to heal, but that instead perpetuates injury. The arteries themselves are not passive victims. They respond to these signals by producing more adhesion molecules, drawing in more immune cells, and thickening their walls in self-defense. Over decades, this cycle of injury and repair creates the hardened, less flexible vessels characteristic of cardiovascular aging. Lifestyle choices profoundly shape this biochemical dialogue. Diets high in refined carbohydrates and trans fats increase small, dense LDL particles and suppress HDL activity. Sedentary behavior reduces HDL activity. Sedentary behavior reduces HDL activity. Sedentary behavior uses HDL, while regular physical activity enhances its function, allowing more cholesterol to be transported back to the liver. Stress and poor sleep elevate cortisol and adrenaline, hormones that shift metabolism toward fat storage and LDL production. Conversely, diets rich in unsaturated fats, antioxidants, and omega-3 fatty acids help protect LDL from oxidation and improve HDL efficiency. Even moderate alcohol consumption has been shown to enhance HDL's anti-inflammatory capacity, though excessive intake reverses that benefit. Every habit either maintains the conversation between LDL and HDL or distorts it toward disease. In older adults, these dynamics become even more intricate. The body's natural defenses against oxidation weaken, and chronic inflammation becomes a near-constant background state. The enzymes that normally remodel HDL particles lose activity, and the liver's capacity to clear LDL diminishes. At the same time, hormonal shifts alter the lipid landscape, with estrogen and testosterone declining and insulin resistance increasing. The result is an environment where LDL tends to accumulate and HDL struggles to function effectively. This imbalance is not solely the result of cholesterol metabolism itself, but a reflection of the larger physiological shifts of aging, slow repair, higher oxidative stress, and diminished energy metabolism. It is crucial to recognize that high LDL or low HDL alone do not predict heart disease with absolute certainty. What matters is how these molecules behave together. A person with moderately high LDL but robust HDL function and low inflammation may have less cardiovascular risk than someone with average cholesterol levels but high inflammatory markers. This is why modern medicine increasingly focuses on particle size, functionality, and inflammatory status than only total cholesterol numbers. Blood tests that measure LDL particle size, or C-reactive protein, can offer a clearer window into how cholesterol is behaving in the body. The harmony between LDL and HDL mirrors a broader truth about biological systems. Balance, not suppression, sustains life. Just as ecosystems collapse when one species overwhelms another, The body falters when one aspect of metabolism dominates unchecked. The ideal state is dynamic equilibrium, where LDL delivers cholesterol efficiently and HDL retrieves it gracefully, supported by minimal inflammation and a resilient vascular system. Every meal, every heartbeat, every breath participates in this quiet negotiation between delivery and return, between construction and repair. To understand the danger of imbalance is to understand the nature of chronic disease. It is not one molecule acting in isolation, but a network of interactions gradually shifting from cooperation to conflict. The body's biochemistry reflects its environment and its history, years of diet, stress, rest, and adaptation. The balance between LDL and HDL is not simply a laboratory metric, but a living measure of how harmoniously the body is managing its internal economy. When that balance holds, blood flows freely, tissues repair themselves, and life continues with quiet efficiency. When it falters, the very same molecules that sustain vitality begin, slowly and silently, to erode it from within. The modern understanding of cholesterol has long been dominated by a single idea, that lower levels are always better. For decades, this belief guided medicine, diet, and public health advice, driving millions toward aggressive treatments and restrictive eating habits designed to push cholesterol as low as possible. Yet, as our understanding of human biology deepens, a more complex and humbling truth has emerged. Cholesterol is not a toxin to be purged, but a vital molecule required for life. And when reduced beyond the body's physiological needs, it can lead to harm, especially in older adults. The obsession with minimizing cholesterol has often ignored the subtle protective roles it plays in maintaining hormonal balance, cognitive clarity, and structural stability. The human body thrives on balance, not deprivation, and nowhere is this more evident than in how it manages cholesterol. Cholesterol is the raw material from which the body manufactures its most critical steroid hormones: cortisol, estrogen, progesterone, testosterone and others that orchestrate the body's response to stress, metabolism, and vitality. These hormones are not optional. They are essential regulators of life processes. When cholesterol is driven too low, the endocrine system loses one of its fundamental building blocks, forcing the body to make difficult compromises. Older adults, already experiencing natural hormonal decline due to aging, may be especially vulnerable to the effects of too little cholesterol. Without adequate levels, the adrenal glands struggle to produce cortisol efficiently, leading to fatigue, poor stress resilience, and impaired immune response. Likewise, low levels of sex hormones can manifest as weakness, mood instability, loss of muscle mass, and reduced cognitive performance, symptoms often mistaken as inevitable consequences of aging when they may in fact stem from biochemical insufficiency. Beyond its hormonal role, cholesterol is integral to the architecture of the human brain. Neurons rely on cholesterol to form and maintain synapses, the connections through which nerve cells communicate. Myelin, the insulating sheath that surrounds nerve fibers and allows for rapid transmission of electrical signals, is rich in cholesterol. Inadequate cholesterol disrupts this system, slowing neural communication and contributing to cognitive fog, memory loss, and even mood disorders. The brain is so dependent on cholesterol that it synthesizes most of its own supply, rather than relying heavily on what circulates in the blood. Yet when circulating cholesterol levels fall too low, it often signals an overall disruption in lipid metabolism that can eventually affect brain function indirectly. Studies have observed correlations between excessively low total cholesterol and increased risks of depression, dementia, and even mortality in older adults, suggesting that the molecule's role in mental health and neuroprotection is far deeper than previously recognized. In the pursuit of heart health, medicine has sometimes overlooked the body's holistic intelligence. Cholesterol serves as both messenger and material. It participates in cellular repair, modulates inflammation, and maintains the integrity of every cell membrane. The outer layer of each cell is composed largely of lipids, with cholesterol providing flexibility and resilience. When cholesterol levels become too low, cell membranes lose stability, making them more permeable and vulnerable to oxidative stress. This can compromise the function of vital organs, particularly in older individuals whose bodies already face increased oxidative damage. The same molecule that medicine has worked so hard to suppress also helps protect cells from the very inflammation that contributes to vascular disease. It is an irony of modern biology that the molecule most feared in heart disease is also one of the body's natural defenders against it when present in proper balance. In older adults, extremely low cholesterol levels are often accompanied by subtle systemic weaknesses, frailty, reduced muscle tone, slower wound healing, and immune impairment. These are not random consequences. They are biochemical reflections of insufficiency. Cholesterol participates in the formation of bile acids, which help digest and absorb dietary fats and fat-soluble vitamins such as A, D, E, and K. When bile acid production declines due to low cholesterol, nutrient absorption declines inefficient, leading to deficiencies that affect skin, vision, bone health, and immune function. Vitamin D, in particular, is synthesized from cholesterol under the skin when exposed to sunlight. A deficiency in cholesterol thus indirectly limits the body's ability to generate this crucial nutrient, further weakening bones and immune resilience. The cardiovascular system itself can suffer from the consequences of excessive cholesterol reduction. Paradoxically, while high LDL has been associated with heart disease, very low LDL can also correlate with increased mortality, especially in the elderly. Some research suggests that individuals with LDL levels below 70 mg/dl may face higher risks of hemorrhagic stroke, liver dysfunction, and even certain cancers. This occurs because cholesterol is deeply embedded in the body's repair and immune mechanisms. It acts as a precursor for cell regeneration and a component of the lipoproteins that neutralize bacterial toxins in the bloodstream. When levels are too low, these defense systems weaken, and the body becomes less capable of responding to injury and infection. The misconception that cholesterol should always be minimized ignores its evolutionary purpose. Nature does not preserve what is harmful. It refines what is essential. Cholesterol is so vital that every cell can synthesize it independently. When dietary intake decreases, the liver compensates by producing more, underscoring the body's deep need for it. In older adults, where regenerative capacity already declines, cholesterol supports the processes that maintain stability and coherence at the cellular level. Its presence ensures that membranes remain pliable, hormones are adequately produced, and repair mechanisms stay operational. Depleting this system is not a sign of progress, but of imbalance. The psychological effects of low cholesterol are another layer of this intricate puzzle. Cholesterol influences serotonin receptors in the brain, the same pathways that regulate mood and emotional well-being. Chronically low cholesterol levels can blunt serotonin activity, leading to feelings of anxiety, irritability, or depression. For seniors already navigating the emotional challenges of aging, isolation, and health decline, such biochemical imbalances can intensify distress and impair quality of life. Restoring healthy cholesterol levels often brings not just physiological but emotional stability, reminding us that mental and physical health are intertwined through the same molecular pathways. The push to drive cholesterol endlessly downward has often been motivated by the desire to prevent cardiovascular events. Yet the emerging reality suggests that an overcorrection can create new vulnerabilities. The human body, especially in its later years, functions best not at extremes but within equilibrium. A cholesterol level that is too low may protect against one kind of disease but invite another. The goal, therefore, should not be eradication but intelligent balance, maintaining enough cholesterol to preserve hormonal vitality, neurological integrity, and cellular strength while keeping inflammation and oxidative stress under control. The wisdom of aging lies not in the pursuit of reduction, but in the cultivation of harmony within the body's interconnected systems, allowing cholesterol to serve its natural purpose as a guardian of stability, rather than a symbol of fear. The concept of an ideal cholesterol level for older adults is far more intricate than the simple thresholds often displayed on medical charts. Numbers alone can be misleading when separated from the living context of the human body. Cholesterol interacts with every aspect of metabolism, circulation, and repair. And what may be optimal for one person could be counterproductive for another, depending on genetics, inflammation levels, diet, physical condition, and the health of the heart's inner lining. The quest for a universal number ignores the profound individuality of human biology. In older adults, the ideal cholesterol profile must be seen not as a static target but as a reflection of harmony between systems, a state where lipid metabolism, vascular health, hormonal balance, and cellular repair coexist in equilibrium. The first consideration is that cholesterol values exist within a spectrum of biological needs. For most older adults, total cholesterol between 180 and 200 milligrams LDL appears to support physiological stability, while LDL levels between 70 and 100 milligrams LDL generally maintain vascular integrity without depriving the body of necessary materials for repair. HDL, ideally above 50 milligrams LDL, plays the counterbalancing role of clearing excess cholesterol and maintaining endothelial protection. Yet these numbers are not strict boundaries. They are flexible markers of a system's overall coherence. What truly matters is not how precisely these values align with guidelines, but how they interact with one another in the context of metabolic function and inflammation. Two people with identical cholesterol readings can have completely different cardiovascular outcomes, depending on how well their bodies manage oxidative stress and how healthy their arteries remain. Inflammation sits at the center of this complexity. Cholesterol levels alone tell only half the story, while the inflammatory state of the body reveals the other. Chronic low-grade inflammation makes cholesterol behave differently, more prone to oxidation, more adhesive to vessel walls, and less responsive to clearance by HDL. Measuring inflammation through markers like C-reactive protein or fibrinogen often provides deeper insight into cardiovascular risk than cholesterol alone. In an older adult with mild hypercholesterolemia but low inflammation and good metabolic control, the risk may be minimal. Conversely, someone with normal cholesterol but chronic inflammation may face greater arterial damage over time. Thus, optimal cholesterol exists not as an isolated number, but as part of a broader anti-inflammatory equilibrium within the body. Another crucial factor is the integrity of the endothelium, the thin layer of cells lining blood vessels. This inner surface is where cholesterol's story either remains benign or turns pathological. In youth, the endothelium is smooth, responsive, and capable of releasing nitric oxide to maintain flexibility and prevent plaque formation. With age, it becomes less elastic and more vulnerable to damage from high blood pressure, toxins, and oxidative molecules. When the endothelium is healthy, even moderately elevated cholesterol may pass through the bloodstream without harm. But when it is inflamed or stiffened, LDL can penetrate the arterial wall, initiating the cascade that leads to plaque. Maintaining endothelial health through diet, exercise, and stress management is therefore as important as managing cholesterol levels themselves. It is not the cholesterol that begins disease, but the condition of the vessel it encounters. Muscle mass and physical activity also redefine what optimal cholesterol means for older adults. Muscles act as metabolic regulators, improving insulin sensitivity and lipid utilization. A physically active senior with strong muscle tone and good circulation can often tolerate high cholesterol levels because their body processes fats efficiently and keeps inflammation low. In contrast, someone sedentary with sarcopenia, age-related muscle loss, may experience greater harm from similar cholesterol values. Exercise not only improves HDL function but also changes the physical nature of LDL particles, making them larger and less likely to oxidize. Therefore, the best cholesterol level is inseparable from the strength and movement of the body that carries it. Dietary context further shapes the interpretation of cholesterol. The same LDL level may signify different things depending on the quality of fats consumed. Diets rich in monosaturated and polyunsaturated fats from sources like olive oil, nuts, And fish tend to produce less oxidized LDL and more stable HDL, even if total cholesterol rises slightly. Conversely, diets heavy in processed foods, trans fats and sugars promote smaller, denser LDL particles that are far more damaging to arteries. For older adults, nutritional quality often matters more than strict quantity. A moderate intake of healthy fats can sustain hormone production and brain function, while eliminating processed oils and sugars reduces oxidative stress that distorts cholesterol's behavior. Genetic factors also contribute to the individuality of optimal cholesterol levels. Some people inherit variants of the ApoE or PCSK9 genes that influence how cholesterol is transported or cleared from the bloodstream. For these individuals, cholesterol levels outside the conventional ideal range may still function safely because of compensatory mechanisms in their lipid metabolism. Precision medicine increasingly recognizes that cholesterol management must consider genetic variability, which can explain why certain individuals thrive with higher LDL or require different therapeutic thresholds than the general population. The liver's efficiency plays a decisive role in this equation as well. Aging slows hepatic metabolism, affecting both cholesterol production and clearance. A sluggish liver may lead to elevated LDL, not because of excessive intake, but because of reduced recycling. Supporting liver health through adequate hydration, fiber intake, reduced alcohol consumption, and antioxidants can normalize lipid metabolism without aggressive intervention. When the liver functions well, it naturally keeps cholesterol in its optimal range by balancing synthesis and removal. The psychological and physiological context of aging cannot be ignored either. Cholesterol influences and is influenced by stress hormones, sleep quality, and emotional health. Chronic stress elevates cortisol, which drives higher triglycerides and LDL production. Restorative sleep and relaxation techniques, on the other hand, lower these stress-related lipid fluctuations. Older adults who cultivate calm through mindfulness, social connection, and consistent rest often display healthier lipid patterns, not because their diet is drastically different, but because their body's internal chemistry operates in balance. When considering all these layers, information, vessel health, activity, diet, genetics, and emotional state, the optimal cholesterol range for older adults becomes less about numerical precision and more about physiological coherence. A senior with total cholesterol around 190 milligrams DL, an active lifestyle, low inflammation, and strong cardiovascular function may embody perfect balance, while another with total cholesterol at 160 milligrams/DL, but chronic fatigue, poor nutrition, and inflammation may be at greater risk. The numbers acquire meaning only when interpreted through the lens of the living system that produces them. The ultimate goal for older adults is not to chase a perfect score, but to achieve biological harmony. Cholesterol must circulate in a body that breathes easily, digests efficiently, and recovers from stress fully. When HDL functions effectively, when LDL remains unoxidized, when inflammation is calm, and when the body's repair systems operate smoothly, cholesterol levels naturally settle into the range that sustains life. The best cholesterol for seniors is therefore the one that reflects not just the absence of disease, but the presence of vitality, a number that fits the rhythm of a body still strong, adaptive, and alive, to the quiet intelligence of balance.